Welcome dear medicos, this is Hypersensitivity Type 1 lecture for Pathology and it is strictly based upon Robbins and Cotr pathological basis of the disease. Let's discuss about its definition. The type 1 hypersensitivity reaction is immunologic reaction developed within minute after combination of an antigen with antibody bound on mast cells basophils in already sensitized individual. Based on the portal of entry, type 1 hypersensitivity is classified into two types. They are local and systemic type. Now local or atopy type occurs when the antigen is confined to a particularly site. Manifest with skin allergy, hives, nasal and conjunctival discharge, hay fever, bronchial asthma and allergic gastroenteritis. May have two distinct phases, immediate or late. Immediate occurs within minute of exposure to the antigen and subsides in a few hours, and late starts 2 to 24 hours later and lasts for days. Systemic is mostly follows parenteral administration, B venom or an intravenous injection of antisera, hormones, enzymes, drugs, etc., but can also result from ingestion of the allergens. Results in systemic anaphylaxis within minute of exposure, urticaria, laryngeal edema, pulmonary bronchoconstriction, vomiting, abdominal cramps and diarrhea. Now mechanism. First, exposure to antigen. This is the first step, which follows antigen presentation by dendritic cells. Recognition of an antigen on Th2 cell which releases interleukin 3/5 by TCR, which recruits eosinophil and releases mediators. Release of interleukin 4 and then differentiation of IgE B cell, production of IgE antibody. IgE antibody binds to IgE Fc receptor on mast cell. Second, exposure to antigen. Antigen binds to IgE antibody previously bound to mast cells. Multivalent antigen binds to more than one IgE molecule, leading to cross-linking of IgE Fc receptors. Activation of mast cells and release of mediators. Type 1 hypersensitivity is involved with two mediators. They are primary and secondary mediators. Primary mediators are immediately released already formed stored mediators which induce smooth muscle contraction, increased vascular permeability, increased mucus production by nasal, bronchial, gastric glands, as well as platelet granule release. They include biogenic amine, histamine, adenosine, 5-hydroxytryptamine, 5-HT. They are biological amine. Chemotactic mediators, eosinophil, chemotactic factor, neutrophil, chemotactic factor. Enzymes such as proteases and acid hydrolases, they contained in granule matrix, and proteoglycans, heparin and chondroitin sulfate, they serve to package and store other mediators in the granules. Secondary mediators are synthesized de novo and released late. Lipid mediators, leukotrienes, C4D4, they are vasoactive and spasmogenic. B4, chemotactic for neutrophils, eosinophils and monocytes. Prostaglandins D2, generated by cyclooxygenase pathway, induce bronchospasm and increased mucus secretion. This is the function of prostaglandin D2. Platelet-activating factors induces platelet activation and bronchospasm, release histamine, increased vascular permeability, is chemotactic for neutrophils and eosinophils, activates inflammatory cells and causes their aggregation and degranulation. Cytokines include TNF-alpha, interleukins 1, 3, 4, 5, 6. They show Th2 response, GM-CSF, chemokines, and macrophage inhibitory protein MIP, IA and V. Cytokines recruit and activate inflammatory cells and mast cells. Now, contribution of mast cell in type 1 hypersensitivity. Mast cells are bone marrow derived cells, widely distributed in tissue near blood vessels and nerves and in soft epithelial sites. They contain membrane-bound granules that possess a variety of biological mediators including PAF, histamine, leukotrienes, C4, D4, E4, prostaglandins, cytokines, ECF, and NCF. Roles of eosinophil in type 1 hypersensitivity. TNF-alpha activates epithelial cells, which releases eotaxin rantase, which is called regulated on activation, normal T expressed and secreted, which recruits eosinophils. And here two mechanisms: produce leukotriene C4 and PAF, activate mast cells, promote inflammation, and by another mechanism contains major basic proteins eosinophilic cationic protein toxic to epithelial cells.